One of the muscles that help in the chewing process and really helps to hold our cheeks in place is the buccinator. The buccinator is going to be a deep muscle that are going to be in our cheeks, and this helps to compress those cheeks, and it helps to hold food between teeth during chewing. This is also known as our trumpeter's muscle because of the allotment of having puffy cheeks filled with air when playing the trumpet. Another example is with newborns and infants who are breastfeeding, so they're using and contracting their buccinator when they are nursing. The temporalis muscles are going to be paired and on the side of the head, and these are going to be broad and fan-shaped muscles that are going to extend from the temporal line of the skull and then attach at the coronoid process of the mandible. So it's going to start superficial at the temporal junction, but then becomes deep to the masseter around the mandible. And so the action of this is to elevate and retract or pull backwards the mandible. And so this one you can feel by placing your fingers along the temples, which will be on the lateral skull at the same level of the orbits. And as you open and close your mouth, you are contracting your temporalis muscles. The masseter is going to be a superficial muscle that is very important for mastication or for chewing. And so it's going to elevate and protract, so pulling it anteriorly with the mandible. And it's the most powerful and important of the chewing or mastication muscles. So this one you can actually feel it contract when you palpate near the angle of the mandible and open and close your mouth. Again, it's a superficial muscle and very large. So after chewing, the muscles that help move the tongue kind of move that food along. And so we have two sets of muscles here. We have first the suprahyoid muscles, and then we have the infrahyoid muscles. Both of these are, in terms of their location, above or below the hyoid bone. So the suprahyoid, these are going to be above, infra will be below. And so the suprahyoid muscles help to anchor the tongue and helps to make that oral cavity and helps with swallowing. Whereas the infrahyoid muscles decreases that bone and that larynx during swallowing and during speaking.